Welcome to Capital Region Health Tech. I'm your host, Jack Arnicke, and joining me today are Dr. Lewis Morrison and Dr. David Morrison from Morrison Dental Care in Clifton Park, and we're here to talk about mini dental implants, a dental procedure that's really been in the news quite a bit lately. Gentlemen, welcome to the program.
Thank you. Thank you.
Let's start with the definition. What is a mini dental implant?
A dental implant is a substitute to anchor teeth into your skull.
Okay.
And mini dental implants are just smaller implants than previously have been used.
And smaller meaning the anchor as opposed to the tooth.
Exactly, because the tooth is the same size. The anchor is just smaller.
Why is this so groundbreaking?
Really, what mini implants let us do differently is place that anchor with little or no surgery in bone where many people couldn't have had another type of implant before.
Now, I know a lot of people with false teeth, with bridges, with dentures, always have the fear of them slipping out or coming out or things like that. Do mini dental implants really help those patients?
Significantly, okay? Because with mini dental implants, you can go anywhere from stabilizing that denture to actually replacing it and putting what effectively is natural teeth back in your head.
Now, when you say stabilizing the denture, you mean you could actually, in some cases, use the denture that exists and actually just put implants in there to stabilize that as opposed and still have the same denture?
Exactly. Or you can go, as I said,
Yeah.
and we can use narrow-bodied mini dental implants to replace one tooth or to replace all somebody's teeth.
Fascinating. How do mini dental implants differ from the older, more traditional implants that I really am not familiar with at all?
Yeah, so a traditional implant is a two-piece system placed surgically into the bone, let heal over time. There's a slow healing process with those, and then a tooth or a denture can then be attached to it. The mini dental implant is a one-piece, narrow anchor that we can place with little or no surgery in just about any type of bone that someone comes in with, and they leave that same day with something attached to it.
So really, it's a procedure where the process of attaching involves much smaller work than it would from a traditional implant, which would involve like a bigger hole, a bigger drill, things like that?
Yeah, the process of placing the implant, a traditional implant, you've got to make, as you say, a hole in the bone to fit that implant. And most places where that's done, the gum is cut and...
It gets to be messy and painful.
Exactly. The mini implant, we don't do any of that. There's a small little perforation that's made, and then the implant is tightened right into place.
And it doesn't hurt in the bone itself?
The nerves are very different.
Really?
We have people who have pretty sometimes tough experiences when the tooth came out. The process of putting the implant in is night and day.
Really?
Yep.
What kind of patients are good candidates?
Any patient who's missing a tooth or multiple teeth, because you don't have, since there's less surgery, you don't have as much health problems that relate to problems with bleeding or other issues. So our patient population is greater even than with conventional implants.
Interesting. And what kind of situations can mini implants be used for? Just about anything?
Yes, and you can see we have a picture of an X-ray of a person with a mini dental implant on their front teeth, and then we have a picture of what it looks like with the tooth replaced, and you can't tell. That's a front tooth, and it's hard to tell which tooth was replaced. Not that long ago, I had a patient in, Sal, who was 92 years old, and his daughter was not happy with the fact that he always walked around without his teeth in. And we were able to stabilize his denture, and the situation worked out very well for everybody.
And I guess that was because they were just uncomfortable. The dentures were uncomfortable.
They're uncomfortable, and as you get a little older, they get very loose.
What mini implants let us do is a wide range of things. We had a patient 2 weeks ago. He walked in with a full set on his bottom teeth of loose teeth. Everything was sore. He couldn't bite into anything. He walked out the same day that we took his teeth out with a set of mini implants in place and teeth attached to them that day. The mini implant can be used to replace a single tooth. If you're missing a couple teeth, if you have a partial denture that's loose or a full denture that's loose, we can use mini implants to make it so those snap in and you can eat again with kind of those prosthetics again.
So really, there are a lot of advantages to mini implants. We didn't even get to cost, but I presume they would be less expensive than the more invasive type of implants. A lot less pain, much more comfortable, less healing time, fewer visits to the office, which is a nice thing for a patient, and much faster healing time. All sounds like a win-win for a patient.
They're nice to be able to deliver these kinds of services to patients. And when you talk about cost, we did have a patient in recently who had an estimate for the reconstruction of his upper jaw with implants that was between $35,000 and $40,000, and we're able to do that for a fraction of the cost with mini dental implants.
Wow, so that's the difference between old-fashioned implants and minis.
Yes.
As far as cost goes. Interesting. There's a lot more that we can talk about, and we'll be back in just a moment to talk about more with the Doctors Morrison.
When it comes to dental implants, there are many different solutions, but only one place that offers them all. Morrison Dental Care. Pain-free, affordable implant solutions customized just for you. Morrison Dental Care, your trusted source for a world-class smile.
Welcome back to Capital Region Health Tech with Doctors Lewis and David Morrison from Morrison Dental Care in Clifton Park. People are living longer and longer, and I hope to even add longer to that. Why is it important to have healthy teeth?
Well, in those years when you're living longer, you want your life to be as full as it can be. Mm-hmm. And having teeth to chew with and not dentures makes a whole world of difference in somebody's lives. A lot of people in nursing homes who have false teeth, the majority of them have their food made and cooked through a blender. Mm-hmm. So they're just drinking their food. And that's one of the most enjoyable parts of life as we get older sometimes, and they're missing it. The story is my grandmother had dentures when she was in a nursing home, and I would go in and work on her dentures, and she'd put them in and tell me how much better they felt, but I knew the minute I walked away, she took them out and put them back in the cup. They don't work very well at all. Mm-hmm. So implants make a big difference in people's lives.
Now, one of the things I had also heard is with dentures, over time, your gum kind of deteriorates, retracts, your bone kind of retracts. Does that have an impact on many dental implants?
Absolutely. When we don't have teeth, we lose bone, and we lose the support for a denture. And we also lose the support for kind of our face. Mm-hmm. Our cheeks can start to droop in without the teeth there when the jaws lose structure. Having mini dental implants in place prevents that.
Really?
Yes.
Totally changes then the way the mouth ages.
The mouth and the whole face and the smile and kind of everything associated with that.
So really with mini implants, your dentures fit so much better?
Your dentures fit in a way that you can go out to eat with friends again. You can laugh without worrying about them falling out. And you can smile comfortably kind of with your friends. I guess that makes a big difference in a person's life. I know some dentists also recommend a sinus lift when dealing with mini dental implants. What is that, and what do you think? When we're looking at an individual patient, we kind of talk to you and evaluate your specific mouth and your bone. Some patients have larger sinuses, and that's one of the issues, as you just asked, that changes as we get older without teeth. The space that the sinus takes up grows. Mm-hmm. Traditionally, to have enough bone to place an implant in the back of the upper jaw, the surgeon would need to go in a separate procedure and add that bone there and let things heal over a multi-month time frame. We now have ways to do that you won't even know it's being done at the same time that we're putting in the implants non-surgically.
So all at the same time, same day, same visit?
Exactly.
Wow, that's amazing. What kind of change is it for a patient to regain their smile and their confidence? Tell me a story or two about what you've seen.
It's so much fun when we see someone 4 months after they get their teeth and they come in 20 pounds lighter, without facial hair because they're not trying to hide their teeth anymore, and just holding their shoulders differently. The life-changing effect that this can have.
I can tell you a story about an individual whose job it was to water ski with the bar being held in his teeth. He lost his teeth. He lost his job. He got implants. He was actually able to water ski again, holding the bar in his mouth with the implants in place. That's how strong and that's how life-changing it can be.
What about eating? I know a lot of people with false teeth, they have trouble with an apple. They might have trouble with corn on the cob, foods like that. What about with a mini implant?
People who have all their teeth replaced with mini dental implants can basically eat whatever they want. Okay, they can eat nuts. They can go back to eating the things they hadn't eaten in 10 years, and that's a big joy to people.
Can you replace an entire denture?
We can.
Okay.
We can replace an entire denture cemented into your mouth that will look and feel like you have your teeth back.
So then it would still be the look of the traditional, the denture that people can remove, but now it's permanently attached. Is that the way that works?
So that's one of the ways we can do it. We can also make it without all of that extra plastic or sometimes metal that's a part of the denture, and it's like you had veneers or crowns done on your teeth.
Now, people have worn dentures for years and then come in and get mini implant. One of the procedures for mini implant, what's their reaction?
Why'd I wait? When can I have steak again?
And the answer to that usually is?
Once things are healed, once your denture's ready, but soon.
Wow, that's pretty good. Whenever you go to a dentist, it's always a very personal relationship that a patient has with the individual. But I think it's also important to discuss the business structure of a practice. What is your business structure?
We're basically sole proprietors and own our office, okay? We're not hired by some large corporation that has multiple offices and moves dentists around from place to place. I like, and so does David, having our name on the door. We're responsible for what goes on here.
All right. And is it a trend in the industry for corporations to take over practices?
It seems that way.
Okay. And the best way, if you're not sure, is to ask.
Absolutely.
Okay.
The Morrison family's been practicing dentistry now in the Capital District for almost 100 years.
Wow. A century-old practice. That's amazing. What's your philosophy? What's your office philosophy?
Our philosophy in the office is really patient-centered. When you come here as a new patient, we spend our time trying to find out not just about your mouth, but about you, and about what you're looking for and what brought you in and how we can help. We see patients who are here for second or third opinions because they've gone to other offices and have been told you need your teeth out and you need a denture. And sometimes that's the case, and that's when we can talk to you about mini implants. Sometimes it's not. We see a number of patients who've been told they're looking at dentures or looking at all their teeth out, and once we sit with them and talk about what's involved and what implants can do, or if they're right for implants, we end up being able to restore their teeth and keep their teeth and work that way.
And so when even though we're talking about many implants, that isn't the only thing you do. If there's a way to avoid that and keep a person's teeth, that's your primary goal?
Yes, and we're a general dentistry practice that we both spent hundreds of hours learning how to place implants and place implants well, and have placed hundreds of them. But it's a part of what we do, and we want to make sure it fits right for your mouth.
I imagine you couldn't really achieve much of this without a really good support staff.
Absolutely. And our staff is one of the pleasures of coming to work every day. We have multiple staff members who are second generation in their family working here. When we get patient reviews back after their appointments, there's a lot of them that talk about both me and my father. We have an equal number that call out a specific staff member that patients connect with. And it's a joy to see for us, it's a joy for us to see the relationships that our staff builds with our patients as well.
The truth is, I feel blessed to come in with the staff that I have. It's a real team that actually works together. We're expanding our hygiene department, and we were interviewing some young ladies the other day, and a number of them remarked about just the sense of feeling between the staff that they have, and they could tell the feeling that they had toward our patients. And they were remarking how unusual, unfortunately, that is in many offices, and how nice it was. And it's a blessing.
And your office is right on Route 9 in Clifton Park, a convenient, easy location to find, and you can get here from just about anywhere in the region.
Yes.
Okay. We're going to take a brief break, and then we'll be back with more from Morrison Dental Care.
If you asked me, where are my real teeth versus where are the implants, I couldn't tell you.
I couldn't have asked for a better outcome. I mean, nobody could see which one is it?
I chew, I eat, I have a bagel. I thought I'd never eat a bagel again. I thought I'd never bite into an apple again.
It's natural, it's comfortable. In my personal way, it has changed how I can feel about things because I can smile.
I'm very happy I did this. It makes such a difference in my life.
Welcome back to Capital Region Health Tech. We've been talking about the advantages of mini dental implants. A lot more comfort, less pain, less healing time, fewer visits to the dentist, and less time involved in each visit. It is certainly less invasive, and there's the issue of cost, something I'm sure, Drs. Morrison, that many people are very concerned about.
Dental implants can be very expensive. We've had, as I said before, people come in with estimates of $30,000 to $40,000 to get their mouth restored with dental implants, and we're able to do that for a fraction of the cost with mini dental implants.
That's quite a difference, I would imagine. What exactly happens when a patient walks in the first time? I presume you don't do any work, that there's just strictly looking around and a consultation. What happens during the consultation?
That's correct. That initial visit, and with mini dental implants, that can be a no-charge visit, is the beginning of our patient-centered process. You come in and we're here to talk with you about the condition of your mouth, what you are looking for, what you'd like to achieve with any type of treatment. We'll look at your x-rays, we'll look at your mouth. We've got a number of different models, and we want you to know some details about what you're getting into and what can be done.
Is financing available?
Yes, it is. We've got financing that we offer in the office. We'll work with you with your insurance and figure out a way to make it affordable for you.
And you design a plan, a treatment plan that is just absolutely custom for each individual patient?
Absolutely. And, some people know in advance, let's say they've had dentures for a long time, and all they're concerned about is the fact that it's loose and they can't go out with their friends and eat. That can be stabilize that denture. Other people come in and say, I want my teeth back. I just can't stand anything in my mouth that's foreign. Okay, so that person is going to need something that's different than the other person. Okay, and if you don't listen and don't help them make that right decision, they're not going to get what they need.
What about fear? There are patients that I know, a couple of people I know, who are just terrified of going to a dentist. How do you deal with people who really have to come in here, should come in here, and are terrified of doing that?
Carefully, okay? Because they have genuine fear. I had fear of the dentist when I was young, and it's real. And we just have to work with somebody to help them through the process of dealing with that fear.
And since you had the fear when you were younger, you have an understanding of what they're going through.
Yes, and you can't, sometimes these people even get mocked and get put down by professionals, and that's not fair to them. They deserve better than that.
Okay. We will be back in just a moment with some more on mini dental implants.
The most rewarding part of my job is seeing the smile on a patient's face.
No one is here to settle for anything but the best. Not the patients, not the employees, not the doctors.
We can help put that smile back on their face. That is everything.
We're back with Dr. Lewis Morrison and Dr. David Morrison from Morrison Dental Care in Clifton Park. You had mentioned your entire practice has been in the family for almost a century, so you've been around a long time. How long have you actually been working on dental implants?
I was fortunate that I studied with Dr. Isaiah Liu at New York Polyclinic Medical School and Hospital, and with him placed my first implant back in 1970.
Wow.
Yes, but when implants got approved by the FDA to use as mini dental implants, that was 15 years ago, and that's when we started placing them.
And you've been doing that really right from the very, very beginning.
Yes.
And you have too,
Since I came into practice, yes.
Mm-hmm. So I guess some people would consider you experts in this field.
We've had a lot of experience.
Dentistry keeps changing over time, as the implant revolution has shown. Why is staying current so important to your practice?
I graduated from dental school about 11 years ago. And if you just think back on technology at that point, there was no iPhone yet. Wi-Fi was not everywhere. Everything has advanced. Mm-hmm. And if we weren't staying current within dentistry, it would kind of be like looking back at when my grandfather used to do it with a foot-controlled handpiece. We practice in many ways now digital dentistry. A lot of the goop and materials that used to be used are gone with the advancements in the technology. And continuing education is how we stay current and up to date with what can be done. And if we weren't staying current with that, we'd be falling behind.
Continuing education for you guys, what about the staff?
We travel around the country a couple times a year, each of us, for various seminars related to implants and other aspects of dentistry. Some of those we bring the staff with us. All of it has to come back, and we teach the staff what we need to know.
Why is it important for the staff to know it, though?
If I go to a course and learn a procedure and they don't know it, they can't talk to the patient about it. They can't help while it's being done. The office needs to be educated, not just us.
Very often you get a better connection when you travel and talk to the lecturer and get a group that's studying together.
And through your years, both of you have gotten a fair amount of professional recognition?
Yes. I hold a fellowship in the Academy of Osseointegration, as well as a study plan from Harvard. And David actually was one of the youngest dentists in history to receive a fellowship from the Academy of General Dentistry.
And with all of the continuing education and the degrees and recognition that you have, it's important for you to do your work. Why is that important to the patient?
One of the things our patients like very much is the fact that we have that educational background that allows us to do almost all our procedures at our office. They don't need to be referred to another office for the surgery to have back and forth, back and forth. And when it comes to implants, that's a big deal because we're responsible for the whole process and we know everything that's going on with the process. And it saves them countless visits and countless concern.
By doing everything here in the office, we're approaching their implants, we're approaching their new teeth from the same cosmetic point of view that we're approaching someone who comes in looking for an improved smile. So they're going to get the benefits of all of our treatment with this service.
Do your research. Check out Morrison Dental Care, and you'll find over 700 five-star reviews.
Good reviews come from the fact that the staff really cares. That comes through.
They give us high reviews because they're comfortable here. They see the professionalism, the kindness.
Those 5-star reviews, it makes me want to go out there and be like, I work for that company.
I don't know anyone that wouldn't want to be part of a 5-star team.
It's really nice because I know they're real genuine.
Knowing that the patients appreciate the care they're getting is great for everyone here.
Welcome back to Capital Region Health Tech as we wrap up our conversation with Morrison Dental Care. And one thing we did not touch on yet is a program that the doctors Morrison have for combat veterans. Explain that.
David took his residency here at the VA in Albany in dentistry. And we realized that there's a section of veterans who are not getting the care that we'd like to see them get. These are combat veterans who oral condition is so poor that it keeps them from taking part in a normal life. And so we have a program to help them at no cost to them. And this year, I'm proud to say we've done about $60,000 worth of care on those veterans.
Wow. It changes their lives?
It changes their lives, and it's actually changed the attitudes of a lot of our staff members. They feel so good about what we're doing, and it's really been great.
Give me a couple of examples or an example of how mini implants have really changed a life, have made a dramatic difference in a person's life.
So, and I can think of countless people who during the process are just counting down the days till their first steak. That is the food that we hear most often,
Really?
that people miss with their dentures, that they can't bite into a good steak. We've had patients who had implants placed in the morning. We talked to them the next day to check on them, see how they're doing. And they were talking about the shot they hit on the 14th hole because they were playing golf the same afternoon after their implants were placed.
Wow. Were they hitting it straighter?
The smile was bigger.
Yes, I can imagine. But still, it's got to be almost a life-changing event for some people who have very bad teeth, afraid to smile. When they talk, they cover their mouth and things like that, and to be able to go out and just not worry about it.
One of the things that we actually do here a couple of weeks or month after we've done procedures like that is people's mouths are sore. They're sore because they haven't smiled in so long, and they're smiling so much that they're actually complaining about the muscles being sore. Great problem.
It's a wonderful problem to have. What does this mean to your staff? I mean, you guys get a great deal of satisfaction out of this. What about the staff? How do they feel?
It's that same level of satisfaction. It's one of the benefits of being in this office and working here. It's the ability to change lives.
I've often said whenever I do public appearances that regardless of your profession, the most important work any of us can ever do is touch someone else's life, and you guys are touching lives. That's important. That's the most important way to live. Yeah. Let's summarize. Why are mini dental implants so good?
Little to no surgery. They are simple to place. They can be placed on patients and in bone that regular implants can't. They can be used to replace a single tooth or a whole set of teeth, and they're less expensive than regular implants.
And you have ways to help people deal with the cost of mini implants?
Yes, we do.
Okay. You are located?
1524 Route 9 in Clifton Park.
Okay, and you have your website?
It's morrisondentalcare.com.
All right. I'd like to thank both of you for joining us today. It's been an enlightening discussion that I've thoroughly enjoyed, and I hope you have too. This has been Capital Region Health Tech. We've been talking with Dr. Lewis Morrison and Dr. David Morrison from Morrison Dental Care. Thank you all very much for joining us, and have a wonderful day.